Nikki Johnston has been doing incredible research about what is pepsin, how does it manifest, how does it interact with our laryngeal tissue. What Johnston and colleagues found in rhinology and laryngology in 2009 and 2010 is that pepsin damages throat tissue even at neutral or non-acidic pHs. So this is why sometimes people are having pain even after they start to make behavior change. Even after you remove the acidic foods and you're not eating late at night, you could still have this inflammatory response. So we'll talk about how do you deactivate pepsin, because that is one of the main steps in terms of really tackling LPR. Another important note is that endoscopies often miss this. You can't see pepsin in the tissues, and we don't have a standardized way of testing for pepsin in the tissues yet. So a lot of people with LPR will have a normal endoscopy, and that can be incredibly frustrating. I mentioned allergy medications. If you've seen an ear, nose, and throat doctor and they have trialed allergy medications, one dead giveaway of LPR is that it does not really respond to allergy medication. And LPR is often diagnosed based on assessment, looking at the way the larynx tissue will look. You do want to see a laryngologist. That is who you want to see, and make sure that you call their office ahead. Like, make sure that they are LPR-informed laryngologists. It's incredibly frustrating to put in the work to book an appointment, go see the provider, and they've never even heard of LPR. So you do want to make sure that they are LPR informed, but they will look into your throat, assess for the presence of other issues, because not all laryngeal symptoms are LPR. This is so important, and there's a big San Diego consensus that just came out about LPR, and one of the key takeaways is not all laryngeal symptoms are LPR. It can be other things: muscle tension dysphonia, allergies, even severe dryness. Like, there's so many things that could impact laryngeal symptoms. The laryngologist needs to look and kind of see if there's signs of reflux. If the only option given to you at the doctor's is a PPI, I urge you to ask more questions. Ask if you need follow-up testing. A systematic review of 72 studies, over 5,000 patients, showed that PPIs only have a mild benefit over placebo, even less benefit for people with LPR when patients got no diet advice. Other meta-analyses showed that high-dose PPI therapy was no better than placebo for laryngopharyngeal symptoms. So a lot of people with LPR will come to us and they feel like they're being difficult with their doctor because they're saying, I'm not getting relief, but actually it's extremely common for people with LPR to not get relief from the PPIs. And this is because the standard acid-only model doesn't fit LPR. So when pepsin is embedded in the tissues, we talked about how it is reactivated by acidic foods and beverages. And so this is why entering into a healing phase where we are limiting or eliminating acidic foods and beverages is very helpful. And you can think of this as like a shoulder injury, right? Like, if you have a shoulder injury and you just keep strict pressing all day, you just keep using your shoulder, it's never going to heal. We have to pause. And this doesn't mean forever and ever you can never have oranges and tomatoes again. That's not at all what we're saying. We're saying we need a temporary healing phase.